Imagine this: you're cradling your newborn, marveling at every tiny detail, when you notice a small, red bump on their belly button. Instantly, your mind races with questions. What is it? Is it dangerous? How did this happen? It's not what you expect when you're busy celebrating new life and the joy of your baby's arrival. But rest assured, you're not alone, and there's no need to panic. Section 1. What exactly is an umbilical granuloma? Umbilical granulomas are incredibly common among newborns. If you've noticed a tiny, moist, red bump on your baby's belly button, that's likely what you're dealing with. It looks like a small ball of tissue and typically appears after the umbilical cord stump has fallen off. Let's break down why it's there in the first place. The umbilical cord is like the baby's lifeline during pregnancy, carrying nutrients and oxygen between the baby and the mother. After birth, though, the cord is cut, and what's left behind is a small stump. Usually, this stump dries up and falls off within a week or two. But sometimes, a bit of extra tissue called a granuloma forms, which sticks around after the stump is gone. This extra tissue is what you're seeing. So why does this happen? Honestly, no one knows for sure. It's not due to anything you did or didn't do, it's just one of those quirks of newborn development. However, granulomas tend to be more likely if the umbilical stump takes a bit longer to fall off. Section 2. Recognizing umbilical granuloma symptoms. Knowing what to look for can put your mind at ease. Umbilical granulomas are generally harmless and painless for your baby. You'll see that red, moist tissue on the belly button, and there might be a little bit of sticky mucus oozing from it. You might even notice some slight irritation on the skin around the navel. It's important to keep an eye on it, but you don't need to be worried. Umbilical granulomas don't typically cause any pain or discomfort. However, they do occasionally get infected, and in that case, you'll want to take action. Symptoms of infection might include fever, pain or tenderness in the navel area, swelling, redness, or warmth around the belly button, red streaks on the skin leading away from the navel, pus draining from the granuloma. If you notice any of these symptoms, it's a good idea to contact your doctor right away. They'll help you determine the best next steps. Section 3. Can adults develop umbilical granulomas? While umbilical granulomas are mostly a newborn issue, adults can experience them too, especially following a navel piercing. When you pierce the navel, granulation tissue forms around the healing site. Sometimes, too much of this tissue grows, leading to granuloma. So if you've had a navel piercing and notice a red, moist bump, it might be a granuloma. The good news? The treatment is the same for adults as it is for newborns. If the granuloma doesn't improve, the piercing may need to be removed temporarily to allow the tissue to heal completely. Section 4. Common treatments for umbilical granulomas. Umbilical granulomas can sometimes resolve on their own, but if they persist, doctors offer several treatment options. Here are the most common treatments. 1. Silver nitrate. This is the go-to treatment for newborns. Silver nitrate dries out the granuloma tissue, helping it to shrink and disappear over a few visits. Your doctor will apply the solution directly to the granuloma, and with time, it will dry up. 2. Liquid nitrogen, cryotherapy. This treatment involves freezing the granuloma tissue so it will fall off on its own. It sounds intense, but it's a quick and safe option, especially for granulomas that are a bit more stubborn. 3. Surgical thread. In some cases, a doctor may tie off the base of the granuloma with surgical thread. By cutting off the blood supply, the granuloma tissue dries up and eventually falls off naturally. It's a simple procedure that doesn't cause discomfort. 4. Surgical removal. If other treatments haven't worked, a doctor can remove the granuloma surgically. Using a small scalpel, they'll carefully take off the excess tissue. Don't worry, this procedure is quick, painless, and very effective. Throughout any of these treatments, your doctor will likely schedule follow-up visits to make sure everything is healing properly. Section 5. Caring for an infant with a granuloma. The good news? Taking care of a baby with an umbilical granuloma is simple. Your doctor will provide specific instructions, but here are a few general tips to keep in mind. 1. Frequent diaper changes. Diapers can trap moisture, which might slow down healing. Change your baby's diapers often to keep the area clean and dry. 2. Positioning the diaper. Try to keep the diaper below the baby's belly button. By folding down the front edge of the diaper, you can prevent it from rubbing against the granuloma, which promotes faster healing. 3. Sponge baths only. Giving your baby a sponge bath instead of a tub bath can help keep the navel area dry. Sponge baths are gentle and minimize the chance of irritating the area. Section 6. Can umbilical granulomas reoccur? Umbilical granulomas are usually a one-time issue. Once they're treated, they typically don't come back. In rare cases, the tissue may grow back after treatment, but this can be managed by following up with your doctor. Section 7. Preventing infection and promoting healing. Prevention is key. To minimize the risk of infection, make sure to clean the area gently, use a soft cloth and mild soap, taking care not to scrub. Keep hands clean, always wash your hands before and after caring for your baby's navel. Contact the doctor if you suspect infection. At the first sign of fever, pus, or increased redness, don't hesitate to reach out to your healthcare provider. Conclusion: what you need to remember. Umbilical granulomas are common and treatable. Most often, they're just a small, harmless quirk of newborn life. However, keeping an eye on your baby's navel, knowing what to watch for, and following your doctor's advice are the best ways to ensure a smooth recovery. So, take a deep breath, follow these tips, and remember, you've got this. The joy of watching your newborn grow and thrive is just getting started. Umbilical granulomas are just a small part of the journey, and soon enough, it'll be a distant memory as you focus on all the amazing milestones ahead.